Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we head to Florida. I speak to Dr. Joseph Perno, the Chief Medical Officer and a pediatric emergency medicine physician at Johns Hopkins All Children's Hospital in St. Petersburg. Let's listen. Dr. Perno, thank you so much for joining us on the podcast. What is the situation right now for children and COVID in the state of Florida?
Yeah, the situation is not good and unfortunately getting worse by the week. We were in a really good position in June, thinking that we had gotten through the worst of the pandemic and we'd seen a record low number of cases in our pediatric patients, and then everything sort of exploded in July. Each week since the beginning of July, we've seen more cases of COVID than we have at all during the pandemic. And each week breaks a new record, and including into early August, where we're still seeing the most number of overall positives of COVID pediatric patients.
So what does that mean for a typical emergency room shift for you?
Yeah, it's been busy. We're seeing generally wintertime volume. We see typically a very seasonality in pediatrics, where the summertime, our volumes are not quite as busy. The respiratory viruses that we see in the winter months traditionally are not around. The kids are relatively healthy outside playing. We have not seen that this summer. We're seeing volumes that would equate to a wintertime month with predominant of COVID and some of the other winter respiratory viruses which have shown their head this summer. So it's made it very stressful. And like I said, as each week goes on, it's getting worse and worse with the number of COVID patients presenting to our emergency room.
So when you do a shift, you're pretty sure you're going to see at least one COVID patient these days.
Yeah, I'm going to see more than one. Yeah, most definitely. It's a guarantee. Our last week, over the last 7 days, we had 100 positive COVID patients that we tested through our hospital. And I think this week will be well past that number.
What about as you get deeper into the hospital? You have patients admitted, even patients in the intensive care unit?
We do. We've seen an increase primarily with the Delta variant is what we think this is all attributed to. But with this new, more contagious variant, we've seen more positive patients presenting to the emergency room. And then a subset of those need to be hospitalized because they need oxygen support or whatever other supportive treatment. And then a subset of those have needed ICU. So we've seen kids of all severity, and we're seeing patients of all age groups. We've seen as young as 3 weeks, a child who got COVID from the community, all the way up to our top age range, which is 21 years of age.
And there are some people who say, and I believe that kids don't really get COVID. Are the parents surprised when you're telling them it's COVID? Are they, how does that conversation go? It is unusual. It has been unusual, but now it's less unusual.
Yeah, we were very fortunate, right? In the early part of the pandemic, is that kids seemed to be spared from the major effects of COVID, and it's usually unusual. Usually, it's the kids who get hit harder than the adults. So we were very, very fortunate for the first 12 months or so of the pandemic. But with the latest variant and with the vaccinations, we find this is a disease of the unvaccinated. So our kids are mostly not eligible for the vaccine, and those that are, we're not seeing high penetration rates. So we're seeing it hit the children now. And yeah, parents are surprised. They thought young, healthy, it didn't matter. And they're frustrated because I think they didn't know what to expect, and this caught them off guard.
Now, some people also have claimed that it's only children who have serious underlying health conditions who are getting COVID. What's been your experience?
Yeah, that's absolutely not true. We've actually had significant illness in otherwise healthy children and teens. So yes, obviously you have underlying medical problems, you're even more high risk, but we've seen healthy kids that have had significant hospitalizations and ICU stays from COVID. So
How has this experience changed the discussions around vaccinating kids, particularly kids for whom the vaccine is now available?
Yeah, so we're really trying to get out there and talk to the parents. We're pleading with the parents that get yourselves vaccinated, right? We need to vaccinate each other to protect those who can't be vaccinated. So I need the parents to get vaccinated. I'm begging them to vaccinate their 12 and older children. Again, the penetration in that age group hasn't been great. Some of it going back to the idea of, well, kids don't get sick. I don't want to try this vaccine. But anybody who can be vaccinated, we're begging them to get vaccinated, both the parents, the grandparents, aunts, uncles, and their teenagers. And thus, that'll help us protect those who right now the vaccine is not approved for, but we're hoping that's going to change in the coming months.
How do those conversations go? Are people more open to getting vaccinated, or are they still pretty resistant?
It's still a challenge. It's vaccination. It's funny to me as I find that either people can't wait to get the vaccine and can't get it fast enough, or those that are reluctant, it's really hard. Now, again, as an emergency room physician, I don't necessarily have that relationship, long-term relationship with a family. So they just met me and they don't know how much to trust me. So maybe it's a little more challenging for me. But yeah, some of the parents, they know what they hear in the media. They know what they hear, what they read on the internet. And they're weighing all those opinions. But, I think I need the local community pediatricians to really talk to their families. The families probably trust them more than they would trust a stranger like myself to have these difficult conversations. But I haven't found many people that say, yeah, I'm running out and getting the vaccine after discussing with them, unfortunately.
Yeah. What is the forecast right now in Florida, and particularly for your hospital? Obviously, you can't keep seeing records every week without it having a toll on your ability to provide care.
Yeah. So right now we're a little bit of doom and gloom. Schools just started here in Florida this week in all the Bay areas. So the kids are now back in school, and we know as pediatricians that traditionally kids go back to school within a week or two. We see a rise of viral illnesses as the children are together and spreading disease back and forth. We have no official mask mandates in the state of Florida. Masking in schools is completely optional at this point. So we, on the hospital side, are dreading that surge that we may see of COVID in the next 2 weeks. And we're pushed right now to almost our capacity, both in the emergency room and the hospital. So I'm really, really worried. And we're working through different surge plans if the worst comes to fruition. We're hoping for the best. We're hoping that maybe there's a die down. We're hoping that parents do the right thing and put masks on their children, whether they're vaccinated or not. But right now, yeah, if you talk to many of us pediatricians in the state of Florida, it's a little bit of doom, gloom, and we're scared.
I wonder whether you have had a chance to talk to school boards or talk to the media, talk to elected officials. I mean, you are really the last line of defense between very sick children and death. That is what Johns Hopkins All Children's Hospital is, the last line of defense. How do you explain your concern? How do you do your best to get people to realize what's at stake?
Yeah, and we've done all those actually, and I've done most of those this week. I spoke to a state congressman yesterday. I've been on local media literally every day. It's a very difficult challenge, especially here in Florida. As true everywhere, COVID has been very politicized. And the feedback coming from the governor of the state of Florida is he doesn't believe in masks. He's pushing vaccination, which we appreciate, but he's really downplaying the use of masks, and he's threatening funding to the schools if they pose mask mandates. So the schools are worried about their funding, understandable. And yeah, we've been on school boards. We've given our opinions, but families have their opinions too. And it's a very divided state. I mean, I understand the division over the vaccine. That's always been a polarizing thing. But the polarizing attitudes towards masking, which we're begging people, to me, it's the simplest thing you could do to protect children at this point. It's a challenge. I'm frustrated because it feels like it's falling on deaf ears. And I feel like the kids are being lost in this political battle.
Wow. Last question is the the staff at the hospital. Seeing all these sick kids, probably having some version of this conversation themselves, seeing, the fact that a lot of opportunities for prevention are being missed. What is the morale like? What do you do as one of the leaders of a hospital to, keep people waking up in the morning and fighting their best for these kids every day?
Yeah, morale is low. I mean, I can't say thank you enough. I mean, I walk around and I thank everyone. I'll be working in the emergency room this evening and I get to experience it firsthand, but it's hard. I mean, our frontline staff are dealing with this. They see that some of this could have been prevented. It's interesting. This is our first real foray into the pandemic. What the Northeast faced, what the adult hospitals faced in earlier parts of the pandemic. It's made its way to the children's hospitals. So it's hard. Everybody is overworked. It's stressed. It's a stressful job to begin with, working in a children's hospital with the sickest of the sick. But it's always frustrating when we see things that we believe to be preventable. Whether it's a drowning patient, whether it's COVID, whatever it may be, you say this child shouldn't be in my emergency room, shouldn't be in my ICU. So it takes a toll on staff. So our leadership is trying to support everyone as much as possible. We're trying to find bodies to staff the shifts, to staff the beds, and trying to let them know that we're all in this together. But it's hard day in and day out. Our staff is definitely struggling.
Well, I just want to thank you for all the work that you're doing and the work that you do to keep the whole team at All Children's Hospital functioning under these incredible set of stresses that you're experiencing and that all these kids are experiencing.
Yeah, I want to thank you for shining a light on this. I think the more points we can get our voice out there, if it changes one person's mind, then that's a good thing.
All right. Good luck.
Well, thank you.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.